All right. So I just wanted to, uh, talk about the same issue that everybody in New York seems to be talking about now. And when I say everybody, collectively, we are represented by the governor, Andrew Cuomo. Topic of discussion: ventilators. Everybody still has the same question. So in today's briefing, same thing. We have enough for this week, but next week we're going to fall short. And the Javits Center, they initially wanted to have it for non COVID-19 patients because we need a spot for those people, and the feds were going to run it. But then he convinced Trump into, and he did give credit to Trump that Trump quickly said, okay, convert this to a COVID-19 instead of non-COVID-19. And FEMA and the feds did not want to do it, but Trump said, guys, we got to do it. So now they suddenly have 2,000 or 2,500 beds for COVID-19 patients. And that ship that they have, I think the name is Mercy, is for non-COVID patients. They don't want any commingling because that's a huge risk. But again, the discussion is about ventilators, and I want to emphasize, and I heard it on some other channels. It seems some other people were trying to help make masks or whatever, and they're getting no response from the governor's office. And again, there's a company in upstate New York, well-established company, technologically sound company, wants to make ventilators. They have a design, they have the capability. Nobody's reaching out to them. Not even reaching out. Nobody's replying to them reaching out to the government. And now, finally, Cuomo is doing what has been circulating on the internet all throughout. Remember how people are saying the anesthesiologists have the same or even better ventilators, but now Cuomo is going to sign this executive order to order them to lend them to these hospitals that are actually providing care to COVID-19 patients. So I don't understand this constant, lagging behind. If you wanted to do that, you could have talked to them and got those. And if you wanted to pass an executive order, you could have done it long ago. Because wasn't he complaining that Trump needs to use his wartime powers to compel these companies to manufacture ventilators? He kept complaining about that nonstop for several days. That, yes, I understand this whole separation, government and private enterprise, and everybody's coming forward to help, but it's not happening. We need to mandate it. How come you're not taking your own pill?
Right.
So he's saying, I'm going to sign this. Right. So he's going to sign it. He hasn't even signed it today. He's going to sign it. Maybe he's signing it tonight at some secret place. But that's what's going to happen. And they're going to take ventilators from private hospitals and, doctors and other things like masks, personal protection equipment, gowns, those kind of things. Some reporter asked, so isn't this government confiscating? He's like, I never use the word confiscation. So listen, guys, your executive order is just that. You're taking it. Right now you're taking it without any due compensation. He's saying, I will pay for it or I will replace it in the future. If payment is not made right now or replacement is not put in any contract, he said, you have my word. That's a spoken word. If there's no contract, that is taking by the government under law, under the Constitution. Can he do it? Can he not do it? That's a different question. Like I said yesterday, all articles and rules laid down by the Constitution, all the laws of the Constitution can be broken based on the scrutiny, the level of scrutiny set by the Supreme Court. Depends on what level. But for example, if it's highest, then it's compelling government interest and narrowly tailored. So this is my message to Cuomo before I go off on other things that he's trying to address here. If you're passing any law, have a sunset clause in it. That's the problem with most of these states. They pass laws, and those laws just stay on the books forever. They'll have a sunset clause. Literally put a date and say we can come and revisit that at that point. Put 2 months, 3 months, whatever you think, because he said it there. By June, hopefully this is over. All right, put June. Make it July, but put it in there. Put a sunset clause, because that would make it narrowly tailored as far as even time is concerned. Don't just go off and sign laws, because you don't own anything. This is government taking. They're also deploying National Guard, right? And today, like 2 or 3 days ago, how everybody was commenting about Trump. Today it was a different Donald Trump. I saw a different Donald Trump. He finally gets it. Guess what? After 3 days, I think Andrew Cuomo gets it, because now it's more than 3,000 people dead in New York. There were no more jokes. There were no family reunions with his brother. There were no talks about his father. And, I'm not trying to disrespect any family here, but there are many families. 3,000 families guaranteed have been affected. There's deaths. Nobody's coming back. We don't need this back and forth banter and jokes. It's not helping. So he was serious today. Finally, the jokes stopped. Finally, nobody was making references of Andrew Cuomo dressed as a ballerina waving a wand. It's ridiculous. You want to have fun, you can have it in your private time. But this whole saving face, distraction of the public, humanizing yourself, there is a time and place for all that. This is not it, buddy. And even today's address to the state of New York was shorter. Wasn't just dragging on and on and on about how his father influenced him, his mother influenced him, how his brother influences him, how his brother's the best guy. We know that. We know every brother feels the same about another brother. We even feel that about friends and neighbors. But this is a nice thing to say, but we have to understand what is the most important thing to say, especially when you're the governor. If it was just me and you rambling around, it's going to sit there on YouTube. We're not making any policies. We can go on and do that. Joe Rogan on his podcast, he has jokes about things. No issue there, because the country is listening to him, but it's not stopping for his orders. He's not in power.
Well, he has to say something, right? Or he feels that he has to say something. And to me, it seems like he doesn't really have much to say besides
he doesn't
like
have
that.
much to say. Right. Yeah. He doesn't have much to say because these patients were created by this administration. I sent you those videos about Blasio in March saying this is not communicable. There's nothing to worry about. Guys, just go on. This has affected only old people. It's not communicated. It's not. This disease is not communicable through casual contact. So go about your life. Get on the subway. Do whatever. And he said this. Even if we were to find a case in the school that a child has been affected, and he says it doesn't affect children and young people, don't worry about it. Okay? And even if we found a case in the school, I'm not going to shut down the schools. These are his words. And this is what happens when you do that for several weeks. Even today, right. Instead of Cuomo focusing on stopping traffic coming up, traffic between, say, Westchester and the rest of upstate New York, and from the other side, maybe Buffalo or Rochester, whichever is a hot spot, stopping traffic there and just containing it for now. And again, I don't mean forever, a sunset clause, obviously. Instead of focusing on that, they're still talking about debts and how they'll manage it. It seems like he really doesn't have anything to talk about. And all they're doing now is managing debts. They're not managing coronavirus.
That's why his whole focus, again, is on the ventilators, right? The ventilators he keeps talking about. But the ventilators, if you get on a ventilator, only 1 in 5 chance you're getting off the ventilator. So why is the focus on the ventilators, right? It's not about, you're right. They're still not talking about what are you going to
and
do
you
to
know
solve
nothing
it?
against the ventilators, because I said there's a company willing to make it, and yes, we can get as many ventilators as possible, but that shouldn't be the sole focus here. The spread is still happening. You can still stop the spread.
About.
He only talks about that. And then a reporter asks about masks, and then he refers that question to his lead scientist or doctor, whatever, and the doctor still is lying about it. He says, yeah, the masks don't work at all. There is no evidence that the masks work except if you're sick and if you're a service provider, a healthcare provider.
Yeah.
What does that tell you? Except you're sick. Guys, what does sick mean? Sick means someone who can transmit the virus. And then you know that people who are asymptomatic can transmit it. And like that other governor from whichever state he is from, he says he just learned that asymptomatic people can transmit it.
Yeah, Georgia.
Now these fools,
they're picking on
these guys know about it. And even if they didn't know about it, I'm a citizen of New York and United States, right? And I put this on our podcast more than a month ago now, that this is communicated by asymptomatic people as well. Children are like bees, like honeybees. They go out, they can get infected. It's like pollen on their feet. They're not affected by the pollen, but they bring it back to the hive. And that's what happened in New York City. And New York City has now collectively become a bee, and it is infecting the entire United States, or at least the neighboring states, like a honeybee. Upstate New York is the beehive. So no word, no talking about that. All he's doing is managing death. Might as well run a morgue. Guys, you're creating more patients. More people are going to be on the ventilators because of your actions today. 2 or 3 weeks from now, we're going to have newer patients who shouldn't become patients in upstate. And he's already talking about this. He's saying right now it's New York City. Now it's spreading to Staten Island. You see all those dots in Westchester and all that. Very soon it will be upstate.
Yeah, that's it, right? We're like he was just tracking a hurricane. That's all I get from listening to that. We're tracking a hurricane. Obvious. They won't give us ventilators. We're not doing anything. New York State is broke.
You know how I look at it? Right, and he's also, we're broke. That's his word. We're broke. And he's also talked about the budget a little bit, very quickly. And he's saying that other states are also going to face this peak and these deaths are going to happen there and everything. It's as if misery seeks company.
Yeah, that's exactly it.
If everybody's miserable,
So you notice in the slide, one thing I thought is just odd. It's every conference they've got the slide with like top states affected. And I'm like, this guy, you're not the president. Who cares about the other states? Let's hear about inside New York. They don't give any details about inside New York. The whole thing just strikes me as a guy who's not good at his job, and he got caught in a bad time, and he's like, there's just nothing to do.
He has never been good at his job. He's great at talking. These are all talking points. It's a well-oiled machine, so just keep rotating it. Put a little foot on the crank and just give it a little cranking. It'll keep running, and that's what it is. The momentum that's running most of these states. It's momentum. So they're riding the wave. Yeah. And New Yorkers are so blindfolded and so mesmerized by this show that they want him to become president. And he's saying New York is broke. The audacity to say that. The highest tax state in the United States is saying New York is broke.
That he's been governor of for 10 years now?
Correct. Third term. And New York is broke. It's the highest tax state in the United States. Effectively, between property taxes and sales tax and all that, the highest tax burden is on New Yorkers.
Yeah.
And he's saying we're broke.
The home of Wall Street, the center of international finance.
Correct.
New York City, one of the biggest cities in the world. Yeah. Yep. And he's the governor. and they're broke. And it's everybody's fault, and we're just gonna give a death count every day.
What? Yeah. You know, I said there were no jokes today. I take it back. What a joke.
Yeah, well said.
What a joke. So his plan is, and then he's saying, we passed the budget, we don't have the money, we're broke, but we're going to somehow take into consideration future income. That means higher taxes. There's no lower taxes here. There is no scale back. There is no lowering of anything. There's no saying, we'll make this efficient. We'll make this efficient. It's either cut off all jobs, people lose jobs, because we don't want even New York state employees to lose their jobs. Yeah, maybe they can take some pay cuts. But a person can take a pay cut if they're not spending on sales tax and income tax and property tax. If they retain more money and these thieves in government don't steal it, then they don't need that much money. It's like this. So everything's bloated. The expenditure goes up, therefore your income must go up. And it's just a catch-up game. It's like the coronavirus and our governor. It's a catching up game. Nobody really catches up. Nobody's really happy with him. And these are jokes with his brother. Finally, those jokes ended. So they want to fund education, health, the same old talk. He spoke to Pelosi that New York was shortchanged. Yeah, so now Pelosi is going to say, all right, if you guarantee me the votes, I'll do this. We do have a plan. Yeah, we didn't do anything we did a lot. We stole a lot, but I guess we didn't steal enough for you. So we'll do that this time. So his coronavirus is completely empty. He says this is an operational model now. He uses that term, and he thinks we don't understand. We understand what the operation is, because he says operational model means ventilators. Yeah, exactly. You're operating a morgue for people. You're saying, if you're going to die on Monday, I'm going to ensure you don't die on Monday. You'll die on Friday.
Yeah, right. He's sitting back in the chair and just accepted it, right? Like, yeah. Well, I guess we're going to have a lot of people die. The next one's looking like Long Island. And, yeah, that's all I got, guys.
I told you so. There's going to be a wave. Now, he's not telling anybody that I created that wave. My policies created this wave. Blasio's policy created this wave. The health commissioner of New York City is responsible for this wave. Pelosi is responsible because she actually came there and encouraged people to come there, and she was walking through crowds.
Don't forget New York Senator
Chuck Schumer was there. Exactly, Chuck Schumer was there and creating these waves. And more power to Wuhan, or strong, let's stay strong Wuhan. Nobody's talking about weaker Wuhan. Here we are dying ourselves. Nobody's pointing a finger. Yeah, we are pointing a finger. It came from there. We're pointing a finger. But nobody's saying death to China or Chinese people. None of that is happening. These are the people who raise these concerns that don't even exist. And they cause these waves. You're right. Schumer, Pelosi, and Blasio and Cuomo. So now he's like you said, he just seems to have accepted that death is inevitable.
Yeah,
and then he talks about we are all the same, we are all Americans. Suddenly the whole talk that was going on 3 or 4 days ago.
Again,
he's just strong,
saying nothing, right? Saying nothing.
No, first it was New York strong. We are New York, right? We welcome everybody. We're suffering because we welcomed everybody. Everybody comes here. Everybody did this. Now suddenly we are all Americans. We're all the same. We have the same rights. We don't abolish any of those constitutional rights. We respect First, Second, Third, Fourth, Fifth Amendments. That kind of stuff. Guys, the other states should listen to this as a warning. Do everything that he has not done. Take care of it. Have and New York too, even now, they should have some interstate, controls, intrastate controls, of course, with sunset clauses. Of course, that goes without saying. And the other states should do that as well. Contain this. stop this until you find the cure or the vaccine which is effective. You've got to do that. And stop lying about these masks. Now Cuomo is saying, yeah, you can wear a bandana. It's not a replacement for the distancing. We know that. Nobody said that. It just slows down the venturi effect of your mouth. When you have a high pressure lung coughing out or even speaking, that high pressure comes out. And when it enters the atmosphere, which is low pressure, what happens to gases or any object? It expands quickly. This is the law of thermodynamics. This is how we maintain. This is exactly how physics works. You atomize everything. And this virus has evolved. It has become successful in doing this. Children talk, youngsters talk, old people talk, everybody talks. Cuomo talks. But of course, all he does is talk. That's different. So you're going to reduce the velocity. You're going to, sorry, go ahead.
No, I'm just saying, I just feel embarrassed for him every time, not in like I feel bad for him way, but it's embarrassing to see him up there. It's an embarrassing
I'm beyond embarrassing. I'm beyond embarrassed. I'm beyond even angry. I'm scared for myself and everybody around me and everybody in upstate New York.
Yeah, you're right.
They have created this scary situation. People are still so naive. They're happy. They go out. They whatever little money they have, $20 and $50, they go to Walmart and buy things. They don't have masks to wear. And they're not even wearing any bandanas because these fools told them none of this works. Even today, his health guy, his top doctor said there is no evidence. So don't. And then Cuomo then takes charge of the question. He says, well, at least it will not harm. Guys, we all know that you can at least reduce the transmission rate a little bit. Maybe 6 feet will become 5 feet. You'll be able to stop it. You'll be able to slow it. What's the harm? But this is how they're going about it, and they keep hopping about, and even if you buy it, make sure you don't wear the N95 mask because our healthcare, then just tell the truth. And why is there a shortage? Are you fighting for N95 masks for everybody or just healthcare workers? Because the healthcare workers are looking at patients, and the patients are the people who are not wearing masks right now. You're creating more patients. You're going to need even more ventilators. You just put a brake on the gas pedal. Do they even understand this?
That's what I mean. It's weird when you watch it. Like, wow, it's embarrassing, and he just goes up there and says, "Here's the death count. Here's other states that are affected. We're all Americans, and here's the next place that you guys should be scared. It's coming to your town here."
Yes, his address is about ventilators and deaths.
Yeah. All right. Don't forget the federal government isn't giving us ventilators.
Yes, correct. Yeah. Yes. So ventilators, how the federal government is not giving them enough, but they have enough for this week, every week. And once in a while he'll compliment Trump or somebody like that, which also makes no sense. There's no reason to. We're not looking for compliments from you for Trump or Trump's compliments for you. Even Trump sometimes compliments him. Like, guys, stop this. We don't care about all this anymore. First the squabbling, now the complimenting, then it will be squabbling again. We are not interested in any of this. So he talks about ventilators, talks about the number of deaths and how there are going to be number of deaths in other states. That's it. And there are some jokes in there, and that's his address. There is no policy, there's no plan, there's nothing. They have completely botched this. They will sweep this under the rug very soon, and we will be expected to go back to our lives and do whatever, they declare. This is ridiculous. It's scary for everybody in upstate now, because now comes this ominous warning that this is going to happen. We're going to see these figures in upstate New York. So he already knows this. He's prepared for this in his mind. And, what are the upstate guys going to do? Some will die. We'll have some statistics. We're all statistics. And all this is preventable. Even today, this was preventable. It's preventable from here onwards because everything we do today will be reflected in a couple of weeks. And I hope every other state is paying attention and taking steps not to repeat the mistakes New York has made. Terrible mistake, man. We have half the number of deaths, almost half the number of deaths of the entire country.
Yeah, crazy.
Unimaginable. You know how scary that must be for these families? Especially, I'm just worried about mutations, like I explained yesterday. I am so worried about mutations. The more number of people infected, the more chances of mutations. Mutations work like Xerox machines, photocopy. You put an original document and you get a copy of the original. It's a good copy. It's a copy of a copy of a copy. It deteriorates. And that's what a mutation is. And sometimes that deterioration just leads to a bad copy for everybody.